The most common questions asked about cancer. I'm an oncology nurse practitioner and I'm here to ask some very common questions. We'll be talking about how cancer is diagnosed, how it's treated, and how can we prevent it. It's found to have abnormal symptoms that do not have any explanation that might trigger your doctor to order some diagnostic imaging. The imaging might be a CT scan, an MRI, or even an X-ray. In that imaging, if an abnormal lesion is seen, that will trigger your physician to now send for a tissue pathology. That abnormal lesion will have to be biopsied. Then it gets sent to the laboratory and the pathologist will determine if there's any abnormal cells that are malignant. That's how pretty much all cancers are diagnosed, with tissue pathology. Some cancers, though, you can find through the blood. Those are liquid biopsies, or we also have cancer markers that can be very high when there's a cancer in your blood, and those are through blood tests. They're not very specific, the cancer markers, but some kind of cancers that are in your blood are diagnosed with blood tests and also bone marrow biopsies. But pretty much the gold standard is a tissue biopsy. Treatment for cancer can be very complex depending on the cancer. It is hard to tell exactly what cancer treatment you might have, but it might include something like surgery, chemotherapy, radiation therapy, immunotherapy, or targeted therapy. There's a multitude of different kinds of treatments right now, and there's over 200 different types of cancer. So it's very difficult to say specifically what kind of treatment you will have, but it might be a combination of most likely chemo, radiation therapy, and surgery, and now we're using immunotherapies and targeted therapies very commonly. Had the magic answer for this question, but there's not a specific thing that you can do to prevent cancer. However, there's things that we can do to reduce the risk of developing cancer in our lifetime. Number one is maintaining a healthy body weight. There's many studies that show that increased body fat increases the risk of developing many cancers, including breast cancers, prostate cancer, colorectal cancers, endometrial cancers, and a bunch of other cancers. So stay on a healthy body weight, stay active, and prevent sedentary lifestyle. That's another very important thing, and also helps your cardiovascular health. And eat healthy. So try to have a diet very rich in fruits and vegetables. Reduce red meat consumption, alcohol consumption, smoking consumption. Smoking cessation is huge. Obviously, we have a lot of lung cancers that are directly correlated to smoking, and now there's new studies that show that increased consumption of red meat and alcohol can increase colon cancer as well. I know now everybody says everything gives you cancer, and there is a little bit of truth about that. I can touch that in another video, but really healthy lifestyle is one of the top things that you can do. And of course, screening. So do your screening imaging like mammograms, prostate exams, colonoscopies, all of those screening that you do at an appropriate age or earlier if you're at high risk to detect cancers earlier. I hope this video was helpful and helped answer some questions. So much for watching this video, and if you're curious about some of the strangest questions I've been asked about cancer, don't forget to watch my next video, and don't forget